Hi everyone, my name is Willemijn. I'm a PhD student in the REAiHL Lab, and I got into this position because I was super excited about working in a group that looks at the implementation of AI models in the clinics. And that's how I got here.
Hi guys, my name is Iman. I'm also a PhD student within the REAiHL Lab. I have a background in technical medicine, and therefore I'm really interested in bridging the gap between the technical world and the clinical practice, and therefore I'm really happy with this position as we are focusing on artificial intelligence into clinical practice.
Of course, I can tell you a bit about one project that I'm working on. I'm working on transparency of AI models. So people often say that AI models are black boxes, and therefore they are very hesitant to work with them in the clinics with their patients. And what we are trying to do is provide them with specific information to make sure that this transparency becomes better for the AI models. And specifically looking into what kind of stakeholders, what information is necessary to give them this, transparency. And you, Iman?
I work on a project that looks at the perception and attitudes of physicians towards AI, specifically ICU physicians. So we are conducting a survey study in 21 hospitals in Europe where we distributed a very extensive survey. And in this survey, we are actually looking at factors that influence AI acceptance and trust among ICU physicians. Because in order to implement AI models at the bedside, we of course need the trust and acceptance of the end user. So we're now focusing on ICU physicians, but we are also planning to focus on other physicians, nurses, etc. So in order to implement AI models at the bedside, we have to do this in the most responsible and ethical way. And as we know, there are many ethical challenges and risks related to AI, especially in healthcare. For example, AI models can exhibit biases, and that's of course something that we do not want in healthcare. So therefore, with this lab, we really try to tackle these challenges and to get the models at the bedside, because eventually we will need AI due to the challenges we are facing in healthcare, such as workforce shortages, rising patient volumes, etc. But we are trying to do this in the most responsible and ethical way.
Yeah, and we do that not only with us. We are, for example, at a more medical, technical background, but we also have in our group philosophers. So we have from all kinds of disciplines. We work together to face this challenge.
Exactly. There are policy-related people. We have philosophers. We have the engineers. There are so many people involved, and also really necessary to achieve the goals that we want.
So regarding the 17 SDG goals, we are mainly focusing on number 3, so that is good health and well-being. And why we are focusing on that, of course, we are working in the healthcare domain, but I think what's very relevant to take into account is that, of course, we look at AI models, but the most important thing is that we improve how we work with patients and the patient experience, and that the patient becomes better. So that's our ultimate goal, and therefore we need responsible and ethical AI, and that it really also enters the clinic. So I think that's the main SDG goal that we are focusing on.